Hello everyone. In this video, I will talk about Bartter syndrome. What is Bartter syndrome? Bartter syndrome is a defect in the thick ascending limb of loop of Henle. It is an autosomal recessive disorder. But first, let's talk about the normal physiology. What are the function of the thick ascending limb of loop of Henle? The thick ascending part is impermeable to the water. In the luminal site, it has a co-transporter, that is NKCC2, which transports 1 sodium, 1 potassium and 2 chloride from the tubule inside of the cell against the concentration gradient. The energy that is required during this process is derived from sodium-potassium pump, which pumps 3 sodium from the cell into the blood and takes 2 potassium inside. So inside of the cell, the potassium and chloride concentration is higher. As a result, potassium and chloride passively diffuse from the cell into the blood along the concentration gradient. Some potassium backleaks and it enters into the tubular fluid through ROMK channel, which makes the tubular fluid more positive, which drives other positive ion like calcium and magnesium to be transported along the paracellular route into the interstitium. This paracellular, that means the space between two cells. About 50% of the calcium enters into the cell through the transcellular route and it is reabsorbed in the blood in exchange of the sodium. This transcellular calcium reabsorption is supported by the parathyroid hormone. Loop diuretics also act on thick ascending limb of loop of Henle and can present similarly like Bartter syndrome. So in a normal loop of Henle, this reabsorption of sodium, which will be hampered in Bartter syndrome, and there will be feature like hyponatremia. Reabsorption of potassium will lead to hypokalemia. Reabsorption of chloride will lead to hypochloremia. Reabsorption of calcium will lead to hypocalcemia or hypercalciuria. Also, there will be feature like metabolic alkalosis, which I will discuss on the next slide. So, clinical feature of this Bartter syndrome is salt wasting, which is hallmark of this condition. Due to the loss of electrolyte, there will be salt wasting. Also, due to concomitant water loss, there will be polyuria. Bartter syndrome typically affects children of about 3 to 4 months of age or as early as possible. So the complaint from the mother will be frequent diaper change, which will suspect the feature of polyuria. And also in clinical examination, you will find the signs of dehydration, like sunken anterofrontally delayed skin pinch, which will suspect the dehydration. Due to dehydration, there will be activation of RAS and raised aldosterone level, which will activate the secondary hyperaldosteronism. Due to secondary hyperaldosteronism, there will be metabolic alkalosis. In secondary hyperaldosteronism, the loss of potassium and hydrogen and gain of sodium and water occurs. But the patient will be normotensive. Why normotensive? Though there will be retention of sodium and water, the loss of sodium is more than the gain. So this patient will be normotensive. So we can say that the feature will be normotensive, hypokalemic, metabolic alkalosis, which is very high for the exam. Due to loss of electrolytes, there will be fatigue and failure to thrive. And we know that Bartter syndrome, the defect is in the chloride channel. So when this chloride channel is affected in the inner ear, there will be feature like sensorineural deafness. So the complaint from the mother will be our daughter or son doesn't respond to sound, which will suspect there will be concomitant sensorineural deafness. Due to hypokalemia, there will be muscle weakness and fatigue. And as there is loss of calcium occurs, this calcium chelates with the phosphate and it will lead to renal stone, that is nephrocalcinosis. Also, you will find the features of renal rickets, which is very different from the traditional nutritional rickets. In renal rickets, there will be features like failure to thrive or delayed dentition. In Bartter syndrome, the hypokalemia is very much more than the Gentleman syndrome because there is a defect in the ROMK channel. So hypokalemia occurs in Bartter syndrome due to two reasons. One is due to secondary hyperaldosteronism and another one is ROMK channel defect. That's why the severity of hypokalemia is more than the Gentleman syndrome. To diagnose the Bartter syndrome, we can do the serum electrolyte which will show hyponatremia and hypokalemia. Serum magnesium is normal because the magnesium reabsorption occurs in the distal tubule, not in the loop of Henle. In the urine, we will find low urine osmolality. The 24-hour urinary chloride excretion is higher and 24-hour urinary calcium excretion is also higher. Now, how can we differentiate Bartter syndrome with Gentleman syndrome? By this 24-hour urinary calcium excretion. Because in Bartter syndrome, there will be loss of calcium, so the 24-hour urinary calcium excretion will be higher. But in Gentleman syndrome, which typically shows the features of hypercalcemia, so the 24-hour urinary calcium excretion is low in Gentleman syndrome. Now, how can we differentiate between Bartter syndrome and diuretic abuse? We know that Bartter syndrome typically presents similarly like loop diuretic, but we can differentiate between these two conditions by 24-hour urinary chloride excretion. Because in Bartter syndrome, this 24-hour urinary chloride excretion will be persistently higher, but in diuretic abuse, it will fluctuate, which means the excretion will be higher when the diuretic effect is present, but it will be again low or normal when the diuretic effect is not present. So the treatment of this Bartter syndrome is indomethacin, which we typically use in patent ductus arteriosus and also in headache like migraine. But it is not the typical treatment of renal tubular defect, but in Bartter syndrome, there will be raised level of prostaglandin. So if we use the prostaglandin inhibitors, we will find the better outcome. And also we can use the replacement of the lost electrolytes as different electrolytes are lost. And in the end, if I want to give a quick mnemonic, that is Bartter's kidney, here K for potassium loss or hypokalemia, I for raised level of renal aldosterone but no hypertension, D for diuretic like VIT, typically loop diuretic, N for site, that is NKCC2, channel defect of thick ascending limb, E for elevated urinary calcium or hypercalciuria, and Y for you get metabolic alkalosis.